Hey, have you ever received a doctor bill that you thought was actually covered by your insurance? Often seniors are left with confusing, difficult situations with bills. They don't really know how to process or what to do, what to say, and how to handle those bills. Stick around, I'm going to walk you through exactly what to do in today's video when you do receive a bill that you should not owe. So one of the things that I like to start out with is never rush paying a bill that you receive in the mail. Often just taking a pause and then knowing the steps to be able to go forward with that bill and asking the right questions. So the first thing I would say is if you've gotten a medical bill from your doctor or specialist, or maybe even an operation or something like that, don't rush to paying it. Call them and say, hey, I'm looking at this medical bill. I want you to be able to kind of put it on hold and make sure that the insurance has actually processed the payment correctly. The second thing is match the bill against your Medicare paperwork. So there's a couple of things here that's very important. One, if you're on original Medicare, you're going to have actually what's called as the Medicare Summary Notice that's going to be sent to you, and it's going to itemize out exactly what was done for procedure and then what was paid for fee for schedule. So you want to look at your Medicare Summary Notice, or MSN, and know if you went to the doctor and there's a bill, let's say if it's a $200 bill, and then there's a fee schedule that you owe 20% of that, then there should be a $40 bill. So if the bill is higher than $40, you would obviously know that something wasn't billed correctly. The second thing is if you have a Medicare Advantage plan, that's actually going to be showing up. What you're going to receive is the evidence of benefit notice. So when you get that in the mail, you're going to look and see, okay, there's a doctor visit, and then there should be an amount owed, which with typical doctor visits, if it's a primary care doctor, you may have a $0 copay, a $10 copay, $15 copay, something like that. Then with the specialist visit, they can range anywhere from $30 to $50 copay. So you're kind of looking at what the plan benefit is. So your Medicare Advantage plan has a summary of benefits. It would tell you exactly what the copay amount cost would be for access of care, or if you went to the hospital, you may pay $300 a day. Then you're looking at the Medicare Advantage plan evidence of benefits notification, and you're seeing if that lines up. If you see a discrepancy, one, typically we tell our clients to call in the office and just ask the question like, hey, I got this bill, I don't know what to do. We typically would explain to them the process of what to do, which is what we're explaining in this video. But if you do have complications, sometimes billing can be complicated. So this is why I said at the first, letting that office know, or the doctor's office specialist, wherever you're getting the bill from, letting them know, hey, there's some confusion here in this bill. Can you make sure to give me a little bit of time to be able to get all the evidence together? And then if I have any questions, I'll follow back up. And then I'm going to walk you through exactly, what are the things and the questions that are the three most important things to be able to look for and ask yourself when you're looking at these bills. So let's go over these three questions you can ask yourself. And this is a great way to just know, like, hey, if these three things line up, great. If not, then I'm going to walk you through exactly what to do. So the first question is, did Medicare or the plan process the claim yet? So one of the things that happens with EMR, electronic medical record billing systems, is you'll go to the doctor office, the EMR actually automates out a bill, and they send that out before that is actually processed through your insurance. So if you've received a bill from the doctor office and maybe it says $100, then there's a possibility that it didn't process through the insurance. So you want to be able to ask the question, did Medicare or the plan process the claim yet? If not, the provider may have billed too early and just need to bill it back through your insurance. The second question is, was the claim denied? And if so, you need to find out why. So often there's a coding issue. It denies the claim, it kicks out a bill and sends you a bill. You may have been on a Medicare Advantage plan for 1 year, change that in the following year in the annual enrollment period time, and then went effective for January 1st effective with a new plan. And guess what? You go into the office of that doctor's office in the first quarter or second quarter. Well, a lot of times, if you're not showing them your new insurance card because you're just used to going and showing up and they have your insurance on file, they had the old insurance on file. So when they go to process that claim, you're not on that old insurance anymore. You're actually on a new insurance. Now, some offices are more savvy with their technology, and they actually will have like an iPad that you're checking in on, and you'll actually take a picture of your insurance card. It's asking you for prompts and steps. So depending on the stage of where your doctor is and how they process your insurance, they can just make an honest mistake, and then you have to let them know, hey, I've actually changed insurance. So this is a side note, very important before I go into the third question is, make sure when you do make a plan change or some form of change to your insurance, even if you're on a United Healthcare Medicare Advantage plan, you go to another United Healthcare Medicare Advantage plan, different plan number, you need to make sure your primary care doctor, your specialist, or access to care anywhere that you go is informed about your recent change. Okay, so very important that you inform them. If not, they're going to process a lot of times under the old insurance unless they're asking for a copy of the new card. Third thing is, does the bill match what you may owe, or the amount that you owe? Does it match? And if not, the bill may be wrong. So again, if you're looking at the summary of benefits of your plan and you have a zero copay for a primary care doctor visit, and you go to the primary care doctor and then they bill you $10, let's say they bill a $10 copay. Well, they may have a code in there incorrect, and it may be billing through United Healthcare's Medicare Advantage plan that has a $10 copay instead of a zero copay. So again, being aware of what your plan covers, and if there's a question in that, always asking. Never paying for something just because you feel like if I don't pay it, something's going to happen. If you communicate with the office, just understand that often offices are very used to people calling in and saying, hey, I think there's a billing issue here. Can you push pause and make sure that this doesn't process out to, like, a debt collector or something like that? And I'm going to get the information together and then I'll get back with you. Now, one of the most important things, and I'll remind you here in a few minutes of this as well, is always make a note of who you spoke to, the day that you spoke to them, and then what exactly went on during that conversation. So just, like a notepad or your way of organizing notes is very important. Who did you speak to, what day it was, what time it was, and then what did you talk about? Because guess what? You call in here and I don't make notes, and you call me back a month later and you start talking to me about what you spoke, it's going to be very front of mind to you. But for me, who talks to tons of people all the time about their health plan options and their different situations, I'm not going to always remember your situation. So reminding that person, hey, we spoke on this day about this situation, I've got a bill that's going out, all of a sudden they'll go, oh yeah, hey, Mrs. Scott, I remember you and I was talking. Did you find out any information? If they're pulling you up in their EMR and they've made notes, which a lot of times doctors would regarding your medical conditions, but staff at the front desk that you're talking to may not. A billing person, that if you're talking to a billing person in the office, is often very organized and they're going to remember things. So make sure who you spoke to about your problem, and then who is guiding you through, working with you to guide through solving that problem is very important. We're going to step into the next part, calling the provider's billing office and exactly what to say when you call. So my suggestion would be, when you call a doctor's office or a specialist's office, ask for the billing person. Now, typically there's somebody in the office or there's a third-party billing administrator, and typically you can get a name or an email. And these are the kinds of questions you want to be able to ask them. And I'm going to give you some just helpful questions to be able to ask. One, was the claim submitted to Medicare or my Medicare Advantage plan? So here's the bill. Was it submitted to my insurance correctly? That's the first question. Was it submitted to the correct insurance information? Again, you may have changed from United Healthcare to Blue Cross Blue Shield plan. And if they're submitting it to United Healthcare, guess what? United Healthcare doesn't show you as a client anymore. You're not insured by them anymore. You're insured by the new insurance company or Medicare Advantage carrier. So making sure that they have submitted it to the correct or submitted the correct information to the insurance company is very important. Was it denied because of coding, authorization, referral, or network issues? So a billing person is going to be able to look based on the bill being sent, was it denied because of one of these reasons? And asking those questions is very important. Like, why was it denied? That's a simpler form. Can you give me an explanation of that? And then the last one, can you resubmit or correct the claim before asking me to pay? So if you know the insurance is supposed to cover it, like a primary care doctor visit for most Medicare Advantage plans, there shouldn't be a high cost. It's typically a $0 or $10 or $15 copay for most any Medicare Advantage plan that exists in the US right now. It's a very small, low cost for access of care to primary care. Hey, can you just resubmit that? I shouldn't be paying this. It sounds like the insurance made an error, and it should be a $0 copay or a $10 copay. Now, here's a great thing about a billing person. Because they may have 200 patients going to their practice that is on that Medicare Advantage plan, typically they'll know, like, okay, yeah, you're right, it's supposed to be a zero copay. I don't know what happened there. I'll resubmit it. Again, making a note, making sure you write down the notes, who you spoke with, the day, and then exactly what you talked about. So the fourth step, what happens if that doesn't work? Well, call Medicare, the Medicare Supplement Company, or the Medicare Advantage Plan Company, and I'm going to go over just some ways to be able to kind of framework exactly what you need to be able to do. So under Original Medicare, if there's a billing issue with Original Medicare, the fee-for-service structure, and you just have Original Medicare and not a Medicare Advantage, or maybe you have a Medicare Supplement. One, if there's a billing issue from the MSN bill that you get, then you would call Original Medicare, 1-800-MEDICARE, and you're going to let them know, hey, there's a billing issue with my doctor. And they're going to ask you some questions, and then they may ask to be able to resubmit that. And you can ask them, can you resubmit it, or can you work, through the situation with me? What is my steps I need to do? So again, you're talking to the government with Medicare. So understand this, when you call back in there, you're probably never going to talk to the same person, but you need to write down who you spoke with, the day you spoke with them, and then the context of what you spoke to them about. That's very important, just following up in case somebody makes a mistake. You've heard me say often, where there's people, there's problems. People get confused about things. People are frustrated. People have bad days. And sometimes you're talking to a person that's living through a situation in their life that comes out in the clarity of what they're doing with their job. And therefore, there's confusion in that, and it creates a problem for you in billing. So that's just part of it. Somebody keys in something incorrectly. If you've ever typed out an email and you type in the wrong, instead of, Bob Jones 123, and you put Bob Joan 123. Well, guess what? Bob is not going to get his email because you typed it in incorrectly. It's just a mistake. So just keeping up with the records. Original Medicare plus a Medicare supplement. Call Medicare first. Then you want to be able to call the Medicare supplement carrier. So calling Medicare saying, hey, there's been a billing issue. This fee-for-service amount doesn't look right. And then they can look at it and go, you're exactly right. As a primary care, just a regular visit, then you should have had this much cost. And then say, I have a Medicare supplement. So once that is corrected, can you send it through the standard billing process to make sure my Medicare supplement picks up the cost for that? And maybe you've met your Part B deductible, maybe you have not, or whatever, but that's just letting Medicare know to ensure that it's sent over to the Medicare supplement carrier. And then watch again for the MSN and also just the EOB that comes in from the Medicare supplement to ensure that it's been covered completely. Stick around, I'm going to cover the last two that are very important, and then we're going to step into a couple of things that are very important when it comes to billing issues that you may not be aware of. So if you have a Medicare Advantage plan or a prescription drug plan, a Part D plan, I would encourage you to call Member Services. On the back of your card, there's going to be a member service or customer service number. You're going to call them and explain to them again what the situation is, that you feel like something has been billed incorrectly. You went to the primary care doctor, you got a bill, and the EOB that you've gotten back doesn't look correct, and talk to them. Again, writing down the person you talked to, the day, and then the notes regarding that situation. So with that, if the bill is wrong, ask for a corrected bill or claim resubmission. And I want to walk you through, many bill issues are not true debts. They may be caused by, and these are just a list of things that cause billing issues. Okay, one, the doctor billed the patient before Medicare processed the claim. Again, the EMR processes out a bill, you get it, and that it hasn't even kicked it over to the insurance. So sometimes their system is wrong. If you get that, sometimes it'll say this is not a bill. Well, guess what? If you get that, it's not a bill. Wait for the insurance to process, then you'll know if you have to have anything additionally to pay. If you know you have a normal routine visit to your doctor and you have a copay and you've paid that, a couple of other things that are really important is keep the receipts. I tell my kids this all the time. When you pay for something, keep the receipt to show validation that you've paid. So in your checking account, it shows that you paid. With the receipt, it balances out that. So if it's zero, obviously it's zero, but keep a receipt showing what you owed. If you paid $15, the receipt's going to show you paid $15. So if they say it doesn't show that you paid for it, you have validation to go, well, my checking account validates and this receipt validates I did pay for it. So again, human error can occur. The wrong insurance was billed. Again, People make mistakes. They send it to the wrong person. Somebody's new in the office. A billing person's new. An administrator's new. The girl at the front desk is processing 2 or 3 people at the same time, and they make a mistake, and it's just billed to the wrong insurance. The Medicare supplement was not billed after Medicare paid. So this is a billing process with typical Medicare. When a bill goes to them, they're going to have a standardized billing system that sends that over in and through the Medicare supplement carrier. But again, if Medicare doesn't submit that through that standardizing billing process, then the Medicare supplement is not going to pay. You want to make sure if you get a bill showing that Medicare is saying you owe money and it didn't process through your Medicare supplement, then communicate with them, tell them to be able to send it over and get that resolved, and then moving forward, it shouldn't happen possibly again. The provider used the wrong diagnosis or procedure code. This happens as well. Coding is a very big issue. I've often said with coding, there's multiple codes, and the codes are different for all carriers. So if you have a Medicare Advantage plan with one plan, maybe you've gone in for a diagnostic testing each quarter or each year. You change Medicare Advantage plans, and they are just used to seeing Betty Smith and typing that diagnostic code in, and it doesn't line out with the carrier because you went from ABC carrier to, XYZ carrier. Well, the coding issue can cause a billing issue, and again, just lining that up. I say when you go in, even if you've shown your insurance card, to always ask, hey, I want to make sure you have the right insurance on file each time you go in. Guess what? Then it falls back on the person doing their job to look and go, yes, I have that on file. Or if you've changed within a carrier from one plan, like United Healthcare's HMO plan to United Healthcare's PPO plan with the Medicare Advantage plan, making sure they're aware, hey, I changed plans, and informing that person that's doing the billing. Typically, it's the front desk, and they're processing that through. A Medicare Advantage plan referral or prior authorization was missing. Sometimes there's an authorization needed. The doctor typically would get something authorized, but you go have a diagnostic test done outside of the doctor's office, or a outpatient procedure done, or an MRI, CAT scan, something like that done, and there was a prior authorization needed. And maybe with that, they went ahead and did the procedure, but without the authorization intact with the Medicare Advantage carrier, they're saying it wasn't authorized, you just had it done and we're not paying. Well, if the doctor dropped the ball on communicating to that facility, then the doctor can communicate and get that documentation and send it to the carrier and say, we did authorize it. Typically, a doctor is going to be able to have certain authorization authority with the Medicare Advantage carrier to have certain things done without having to get written authorization, but an informed authorization sometimes is needed, or a billing issue occurs. I won't get into the weeds on that, but if that's happened, then just say, hey, doc, I need your help with this, with the staff there at the office. The service was denied, but may be appealable. Sometimes you're trying to have something done outside the doctor's office. It's denied. You don't know why. Sometimes coming back to the doctor again, just communicating, and then letting them have clarity with what's going on with the insurance company, and then having something approved. Again, because of fraud, waste, and abuse, there are boundaries and rules and regulations around Medicare Advantage plan. Those rules and regulations are starting to change with even original Medicare. And it used to be the wild, wild west with original Medicare. People could just go. We're seeing this across the U.S. right now with fraud, waste, and abuse in states dealing with Medicaid and hospice. And California is shutting down multiple hospice locations. And these people are just shutting their offices down. They're not even appealing the process because, why? Because they're crooks. So when things like that happen, it does affect how policy and procedures affect our access to care. And sometimes you've been used to, maybe for 2, 3, 4, 5, 10 years of getting care through your insurance company. Now all of a sudden there's new policy in place that requires some authorization from the doctor. And the doctor may not be informed of that, or some situation that caused that, but just having a conversation with them, having a conversation with your insurance company, again, making notes, keeping a calm, clear head, and not getting too frustrated. And then lastly, guys, stick around just for a second. I want to explain to you one of the most important things that's going to help advocate and simplify and guide you through when there's problems in your billing, what you can actually do that'll help you the most. So one of the greatest things that you can do is have an advocate in your corner when it comes to billing issues. One of the things that I often say, and we say this all the time to several hundred people, thousands of people, year after year after year, is that having a licensed professional that helps guide you through solving problems like this is very important. That's what our agency is all about, providing you customer service and support. So when you do have a billing issue, you're actually able to call in and say, I have this issue, what am I supposed to do? Most of you are not organized to be able to keep a step-by-step guidebook over in your filing cabinet and you pull that out every time you have a billing issue. And billing issues can be very complicated and frustrating. I would encourage you to be able to link arms and work with an independent insurance brokerage that specializes in Medicare health plans just like we do. If you do not have that, my encouragement would be call and schedule a review, schedule it for the fall of the year. We would love to be able to review your plan, link arms with you, keep you on the same insurance, but also provide you someone that you can call in when there is a problem. We often find that people that have the most craziest problem situations don't have guidance, have not been told correctly, and they're asking somebody at the front desk, or often they're asking and engaging in such a hostile way because they're so frustrated about the situation. We often will remind them, taking a deep breath, stepping back, telling us, clarifying what's going on, and then having somebody guide you through, really to make your life easy by making Medicare simple. The billing process is a part of that process. We'd love to be able to help. If you don't have anybody, click below or give us a call. We'd love to be able to give you a review and answer any questions you may have dealing with your billing issues going on right now. Until next time, guys, I'll see you on the other side.